Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
When the pandemic hit, I think we all had to immediately become public health experts, and a lot got lost there. So maybe now's the time to step back and learn a little bit about how it works.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to make informed decisions to live your best life. But before we get started, we want to be sure that everyone takes a listen to all of GHLF's great podcasts. We have so many to choose from.
We sure do, and you can check them all out at ghlf.org/listen. This week we'll give a shout out to Talking Head Pain, hosted by Joe Coe. In one of the latest episodes, Joe chats with Dr. LaRue about starting migraine associations in Canada.
Great.
Let's start with a listener comment. Are you ready, Stephen?
I am ready.
This one is from Sammy S., who wrote, "I look forward to this weekly. So happy I found this podcast."
Well, thanks, Sammy S. This week in the news, there was a final rule issued on how surprise bill disputes will be settled. Early on in the year, we talked about the No Surprises Act, now a federal law that protects patients from out-of-network medical bills when they seek care in network facilities.
What this means basically is that now the surprise billing arbitration rules have been finalized. And this is just about how billing disputes are settled because, there still is a bill. And although the patient's not responsible, it has to be handled in some way. So, if you're seeing this as someone that lives with chronic illness, don't worry, your protections still remain the same under the Act.
This rule is just about how the bill gets paid and what factors are considered for claim disputes. The final rule says that arbitrators charged with settling disagreements between out-of-network providers and insurance companies must first take into account the median in-network payment rate for a service, but also consider other factors, including providers' training and experience, the market share of a medical facility or insurance plan in that geographic area, how many services the provider offers, and whether it is a teaching facility, for example.
That is a lot of things to consider, and I'm glad it happens on the back end and patients can get the care that they need.
In bigger news, or more interesting news for our listeners, Pfizer has announced that they've asked the FDA to authorize an updated version of their COVID vaccine.
So this is the one that's specifically designed to target the Omicron subvariants that are now dominant in the US while also containing the original coronavirus strain, right?
Correct. They've submitted their preclinical data on vaccine efficacy to the FDA, and this is a new booster that will target both the original coronavirus strain as well as the BA4 and BA5 Omicron subvariants.
I think that if the vaccine's authorized by the FDA...
Oh, is Macintosh vaccinated? He wants his vaccine. I know it.
Yes. He's almost due for his yearly boosters.
There you go.
He's ready. If this vaccine is authorized by the FDA, distribution could start immediately, which would time really well with potential fall and winter surges, as we've seen with a pattern over the last couple of years that cases continue to rise, and this could get ahead of a new variant if it's approved so quickly. One important thing to note about this news update is that the data that they submitted is a little bit different than what was used in earlier vaccines authorizations. So instead of waiting for the test results from human trials, the FDA just asked the drug companies to initially submit the results of tests on mice. And they'll look at those results while the human trials are starting this month. Basically, they're relying on those results along with the human neutralizing antibody data from the earlier BA1 bivalent booster studies because they had done vaccine studies on the earlier variants and then they said we'll make it more updated for BA4 and 5. So there are still studies to look at. Our last piece of news is that Dr. Fauci announced he'll be stepping down later this year.
After 38 years as director of the National Institute of Allergy and Infectious Diseases, Fauci says he's leaving that position as well as his role as President Biden's top medical advisor in December.
To lead any institution for that long is really just incredible. That's a testament in and of itself. He has advised 7 U.S. presidents, starting with Ronald Reagan, through the HIV/AIDS epidemic, West Nile virus, the 2001 anthrax attacks, various bird influenza threats, Ebola, Zika, and of course, COVID and now monkeypox.
By the way, when he made this announcement, he said, I'm going to focus on the next stage of my career. It isn't like, okay, I'm going to go sit on a beach somewhere. He's ready and excited to do more.
Boy, at 81 years old, I hope that I'm having a next phase of my career.
And me too. And of course, many of us have become familiar with Dr. Fauci in COVID. He stepped into the spotlight, so to speak, in 2020 as, the face of the pandemic response.
It's interesting. Some of the news reports refer to Dr. Fauci almost as controversial, which is so, if I may say, just unfair. The job of being the face of public health when dealing with a pandemic is so difficult, trying to thread that needle between placing fear, the appropriate amount of fear in the public's view so that they take action, but not overwhelmingly fill them with fear. And you're never going to make everyone happy. In some instances, you're going to really make people upset. And in the age of social media, it's easy to get people riled up. It's unfortunate that there was so much negative blowback to someone who has worked so hard in his career for public health.
Think back to how stressed we were in that time. And I know there's still a lot of stress, especially for our community. But back then, when we were really hunkered down at home and you sort of want something to be mad at, and you can't totally be mad at a virus. And then there was this figure, Dr. Fauci, who stepped in. And I think a lot of people directed anger towards him, which isn't fair because public health isn't political. It's about protecting the health of the community. We're making the decisions for the health of the community, and sometimes those decisions can counteract your personal opinion.
On a very related note, there's a major change happening in public health leadership in the United States. CDC Director Rochelle Walensky has ordered an agency overhaul of its structure and operations.
We learned some hard lessons over the last 3 years, and as part of that, it's my responsibility, it's the agency's responsibility to learn from those lessons and do better.
Similar to what we were just saying, we know there's been a lot of criticism of the CDC, of how it's handled COVID and now monkeypox, and this overhaul is an attempt to modernize the agency and rehabilitate that reputation.
Yeah, the goal is to improve how the agency shares information, develops public health guidance, and communicates with the public.
Let's dive into some of that criticism. What happened? We talked about this in an episode a while ago that, since COVID, public health officials have come under attack. Many have accused the CDC of federal overreach, and on the other side of it, many in our community have said, the CDC are just not doing enough to protect us.
The CDC's authority has been challenged in multiple court cases, such as with the CDC's directive that people wear masks on public transportation.
They're trying to clean up messaging. The guidance has been changing quickly and confusing. And I know that the COVID landscape changes quickly. So, of course, the guidance has to follow that. But that community level chart, there was some feedback that was really confusing for people. And it sort of got people fatigued from all the change that people are lacking trust.
It is fatiguing. Interestingly, in March 2020, according to a survey by the Pew Research Center, 79% of Americans said public health officials, including those at the CDC, were doing a good job responding to the pandemic. By May of 2022, only 52% of Americans felt similarly.
Wow, that is a pretty big jump in 2 years.
Yes, it is.
Reviews were done to spark this change. I saw that there was 2 reviews in recent months, one by the Health Resources and Service Administration officials, and they looked into the pandemic response, and another was the CDC Chief of Staff into the agency operations. And what the review said essentially was that, traditional scientific and communication processes were just not adequate to effectively respond to a crisis with the size and scope of the COVID pandemic.
McRae's review outlined a series of recommendations for improvement. Number 1, releasing scientific findings and data more quickly to improve transparency. Number 2, translating science into practical and easy to understand policy. Number 3, improving communication with the public. Number 4, working better with agencies and public health partners. And number 5, training and incentivizing the agency workforce to better respond to public health emergencies.
That all sounds great. And think about it through the lens of our community. People want information. We want to know, how does this disease impact us specifically as someone living with a chronic disease who may be immunocompromised because of our condition or medication. So, if the CDC is going to be more transparent and improve communication with the public, I hope that our community is recognized in that, because I know we've been feeling a bit left behind in the guidance, but this sounds promising.
It does. But this all begs the question, what is and what should be the role of the CDC?
It's a good question. I saw that Director Walensky said, I actually really think many people have thought this is CDC's responsibility to fix public health in the pandemic. But the CDC alone can't fix this. Businesses have to help. The government has to help. School systems have to help. This is too big for the CDC alone.
Their name is the Centers for Disease Control and Prevention. That's who they are. They're a U.S. federal agency mandating with protecting America's public health, which is vague to say the least. I'm just reading from their website. This is their mission statement on their website. The CDC works 24 hours a day, 7 days a week to protect America from health, safety, and security threats, both foreign and in the United States. Whether diseases start at home or abroad, are chronic or acute, curable or preventable, human error or deliberate attack, the CDC fights disease and supports communities and citizens to do the same. That's somewhat vague, protect us from public health. Great. It's similar to saying, well, the role of the police department is to protect us from crime, or the role of your local fire department is to protect us from fires. I guess the question is, in execution, are they an agency prepared to deal with a pandemic, such as we dealt with the last 2 years? Are they prepared to deal with the political actors that necessarily have to carry out some public policy pronouncements, public health policy pronouncements? And as a friend of mine said to me, are they just not prepared to be a wartime consigliere, to quote from The Godfather? They're fine perhaps dealing with more low-key public health, under the radar items, such as trying to keep the health of Americans in check, so to speak. When things get hairy, are they really the agency to go to?
And I think that goes back to the director's quote I read a few minutes ago that really says we can only do so much, but we need the help of these other institutions. And aside from that, that is made up of individuals, and we need the help of individuals doing their part in order to make these efforts successful. But the CDC itself can't be responsible alone.
Right, which sort of begs the question, again, in the real world, the agencies are headed by folks that have political bents, if you will. You don't get to run an agency, certain agencies, particularly cabinet level positions like Health and Human Services, without some understanding of the politics involved of what you're doing. You have to deal, of course, with the president. You have to deal with local state health officials who have to answer in turn to governors and mayors who are elected officials. So there's an element of politics and dealing with the public that is very tricky and difficult to navigate. Just as a simple note, the CDC is located in Atlanta. They're not even headquartered in Washington. I mean, that alone, I find fascinating that the emergency response from this is not headed in Washington, which is where the leaders are.
And speaking of the leaders, in this discussion, I'm thinking of the FDA and the NIH, the Food and Drug Administration, the National Institutes of Health, and how does that fit into the CDC's role, and what are each of them responsible for? So, the FDA supervises drugs, medical devices, clinical trials, and it enforces the federal Food and Drug and Cosmetic Act. So when you think about COVID, the FDA has been the one that's responsible for authorizing the vaccines, the at-home tests, stuff like that, while the CDC may give a recommendation. The FDA is sort of the final say.
Yeah, I think that's fair to say. Well, the FDA by law is the only agency that can officially approve a drug.
Yes. And then the NIH is focused more on medical research, and they're responsible for those important discoveries.
Right. So bringing it all together, layered on top of that is the CDC. And the CDC, they're more of your public health folks. They advise local health departments about diseases. They advise the federal government and in particular other federal agencies, the president, the executive branch about disease outbreaks that might be going on. They deal with chronic illness, how to address various disease states going on in the United States. But it's essentially for others to promulgate policy and, most importantly, enact and enforce that policy. So it does beg a question. Is there a particular person that should be layered on top, a sort of health czar, if not entitled, and certainly indeed, it felt as though at times Dr. Fauci had played that role. At times, it feels like the Secretary for Health and Human Services plays that role in non-pandemic public health environments. But there is no one person that the president taps at any particular time to say, hey, you're our health czar. You're going to get us out of this. And not that there should be, because then, like Dr. Fauci was, you have all eyes focused on you, which may not be a good thing either.
I think maybe this overhaul will be helpful for us understanding the role of people in the CDC and how the agency works. I think there's going to be some new teams overseeing this overhaul, and they said they're going to increase communication. So hopefully the pieces will start to come together a little bit more. When the pandemic hit, I think we all had to immediately become public health experts, and a lot got lost there. So maybe now's the time to step back and learn a little bit about how it works.
Absolutely. And unfortunately, Zoe, I don't think we're going to get the answer in our 12-minute little podcast here.
Yeah.
But my best advice would be something akin to, when necessary, it should be incumbent upon a president to appoint someone almost temporarily to be that czar. President Obama did this with Ebola. He appointed Ron Klain, who is now serving as President Biden's chief of staff. So Ron Klain, he's not a public health expert, but he's somebody that understands government. He's someone that understands politics and policy, and he is smart enough to get up to speed when it comes to public health issues and can act as the liaison, and also understand when the CDC or some of the public health folks are not speaking publicly and making sense to the general public. He's someone that can help interpret that for the general public and certainly to the president to help promulgate stronger policies. So that would be my suggestion. Is I don't think there needs to be necessarily an ongoing health czar at all times. I think that would be unfortunate. But when needed, you could sort of have that role, somebody that steps up almost to a cabinet level type position within the White House.
I think many in our community would appreciate that because, they're looking for someone that's going to help guide. And if there is that person, it could be really comforting in a stressful time.
Absolutely. And I would also caution and get back to the idea of clarifying the role of the CDC, which is investigating, figuring out what's going on from their perch way down in Atlanta, figuring out what's going on when it comes to diseases, and then promulgating suggestions that go up the food ladder. And by the way, I felt as though we spoke somewhat negatively about the CDC, but before we close, I do want to say I still rely on the CDC. I go to their website. I know that they are still, I think, the gold standard when it comes to information about public health, information about what one should do when it comes to various diseases, whether it's flu, Zika, heart disease, diabetes. Their website is more trustworthy than any other source. I'm grateful that the CDC exists and puts the information out that they do.
Yeah, me too. And by the way, not just in the US, but they're highly respected all over the world. On that note, that brings us to the close of our show. What did you learn today?
I thought it was interesting when we talked about the new Pfizer vaccine coming out. Instead of waiting for test results from human trials, the FDA asked Pfizer to initially submit the results only on mice so they can get this going quicker. And I'm happy to hear that.
Yeah, me too. And I learned from you about, the final ruling on the No Surprises Act.
Well, we hope that you learned something too. We'd love to hear from you about your advocacy stories. Send your email to thehealthadvocates@ghlf.org. Or better yet, include a short video or audio clip.
And who knows, whatever you share may be included in our listener feedback portion of future episodes.
Also email us if you want to subscribe to our weekly newsletter, where we share the top health news of the week.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, give us a rating and write a review on Apple Podcasts, and definitely hit that subscribe button wherever you listen so you never miss an episode. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.